will mark 2 deaths a day. That's more than die in traffic crashes in Washington. Like a lot of meetings here at the state capitol, the governor today was surrounded by his cabinet members, but he looked to a woman who's in recovery to find out what has kept her from being one of those statistics. From heroin to prescription drugs, they're all considered opioids, and in Washington this decade, they've been deadly.
It is too dangerous, it is too devastating, and it is too prevalent.
Governor Jay Inslee calls it a public health crisis, and last year ordered state agencies to find solutions. Today, he was looking for updates.
Work to improve opioid prescribing practices has been ongoing for the last 10 years.
While the latest figures show a slight drop in overdose deaths in Washington, state officials say increasing the number of needle exchanges and drug drop-off boxes would help, along with funding increases for more medication and counseling, even in state prisons.
For me, where I started, I was homeless and definitely suffering from post-traumatic stress disorder, as well as injecting heroin.
Thea Oliphant-Wells, part of the governor's panel, credits a social worker for getting her into recovery 12 years ago.
What do you think is the most important here to give people a success like you've had to date?
I don't think that my story is remarkable. It's just that I managed to get all the things that I needed.
She says getting mental health treatment along with drug counseling helped, but so did getting a place to live.
Can you imagine having a complicated chronic medical condition and living in a tent in the woods? Are you going to make it to all of your appointments? Are you going to follow through on all of the medical advice that your doctor has for you?
Oliphant-Wells credits a long list of programs and people who kept her from being one of those statistics.
Yeah, I think all the time, the nurses, the social workers, those people who really went out of their way to let me know that I was cared about and that I could have, a better life were vital.
And she's been able to thank those people by helping others. She ended up getting her master's degree, and now 12 years later, she is a social worker at a needle exchange in King County. One issue that did not come up today, the so-called safe injection sites. The governor says that local governments and not the state should be the ones to decide whether or not those are the best options for those communities. Live in Olympia, Drew Mikkelsen, King 5 News.